Good morning. I'm going to call to order this meeting of the Monroe County Board of Commissioners. It is Wednesday, February 9th, and we will begin by noting that everyone is present, and our public statement will be read by Commissioner Giffens, please.
Morning. We, the Monroe County Board of Commissioners, renew our commitment to welcome and protect the rights of all people, regardless of age, race, color, creed, disability, sexual orientation, gender identity, marital status, economic status, and national origin. And we affirm the right of every person to live peacefully and without fear, and we will fight and resist at every step discrimination and harmful policies, whatever their source. We also stand in support of our county public school systems, both RBB and MCCSC.
Great, thank you so much. Next on our agenda are our department updates, and we will begin with the Health Department Administrator, Ms. Caudle.
Good morning. Thank you for allowing me to be here again today. We do remain in a red advisory this week, but there are some continued glimmers of hope, and we see improvements across the county and the state, and I want to just share kind of where we are. Transmission is still very high in Indiana and in Monroe County, yet a steady decline seems to be emerging. This decline was occurring before last week, and it is expected to continue. Omicron has shown steep, fast surges followed by steady declines, which is what's currently being watched. We are not out of the woods, but there are some good signs. The Indiana surge started in the northern part of the state, and that's where the biggest improvements are currently being seen. Cases have decreased significantly in the northern part of the state, with some counties seeing a 90% decline since the Omicron peak. Positivity trends do remain high, but are also improving. There are still over 28 counties with positivity rates over 30%. Earlier this week, there were 7 counties under 20%, which we haven't seen in a while. So, that's the positive. We are hovering around that 20% mark locally. To be clear, 20% is high. So we don't want to mistake this sort of promising report of saying things are good. However, they are seemingly getting better. Our numbers this week are a little bit lower and likely impacted by the weather closures from last week. And that may not be the full reason. So I'm very interested to see what next week brings. I would expect a little bit of a blip. Kind of probably next week we'll go up a little bit from where we are this week, and then hopefully start to come back down. But we will see. As I've said many times, I have no crystal ball. And as you know, no single piece of data tells the full story. We have to look at the big picture. So for example, hospitalizations for COVID are beginning to decline. Again, differing parts of the state are seeing differing declines. Treatment and the possibility of more people being eligible for vaccine are also additional measures to help move us into a better place in the future. There is another study out regarding the effectiveness of masks. People who reported always wearing a mask in indoor public settings were less likely to test positive for COVID-19 than people who didn't. Some notes about that. A cloth mask wearer reduced their risk by 56%, a surgical mask by 66%, and a KN95 or an N95 by 83%. Remember that wearing a mask correctly is the key. And a cloth mask with multiple layers, heavier material, and perhaps with a filter is much better than a thin mask. So the mask you wear matters. No mask is effective when it's worn incorrectly, such as on your chin. So what does all this mean? It means that transmission is still high in Monroe County and in the state of Indiana. Masks do help to reduce infection and transmission. The data is holding true for how Omicron moves through other places, and we are optimistic that we are moving through this surge of Omicron. Vaccination is still our best tool to end the pandemic and to reduce the risk of a new surge. Continuing to use all of our prevention tools will allow us to move forward from this pandemic. Thank you.
Great. Thank you so much, Ms. Caudle. It is good to hear optimism, but we are not done yet. So that's the key. Comments, questions, Commissioner Giffens?
No, I just want to thank everyone who does wear a mask and who socially distances.
Yeah, absolutely. Commissioner Jones?
Yes, I agree. And I also want to thank the health department and all the staff for all of their very hard work during this pandemic.
Absolutely. Yes. That great board and all of those healthcare workers out in the field, let's try to give them a little bit of a break. And the decline is such that we still have cases. It doesn't just end immediately. So we still have a lot of cases and we'll continue to have cases even through this decline. So we have to keep that in mind. Yeah, great. Thank you so much. Let's see if there's any other departments that wish to offer an update. Okay, I don't see any. I'll double check here. All right. All right, so I think we want to revise the agenda a little bit.
Yes, I'd like to move that we review and vote on item C, move that up to the beginning of new business.
Second.
Okay, we have a motion and we have a second to revise our agenda, moving item C to the beginning. Mr. Cockrell, will you please call the roll on that?
Commissioner Thomas?
Yes.
Commissioner Giffens?
Yes.
Commissioner Jones?
Yes.
Motion is approved, 3-0.
Thank you so much. So Ms. Caudle will be hearing from you sooner. Next on our agenda is public comment. This is public comment for items that are not on our agenda. Each commenter will have a total of 3 minutes to speak. And at 2 minutes and 30 seconds, you will hear a tone. Thank you so much. When you hear that tone, that means you have 30 seconds to wrap up your comments. And it looks like we have a couple of commenters. We're going to ask you to give us your name and let us know whether or not you are a Monroe County resident. So first, it looks like we have Angela Northcutt.
Hello, my name is Angela. I am a Monroe County resident. I do have a question. Is this something that I can ask you questions or it's just for me to talk?
Well, it's typically a time for comment.
Just so you will not answer my questions.
We may be able to. We might not be able to.
Okay, I wish that Penny would have stayed on really because I actually had questions for her. I called her this morning. She made comments about the masking and about how our county fares and the numbers. The thing is, I would like to see data because we are under a mask mandate, the only one in our state. And if a mask mandate was truly working, our numbers would be significantly lower than every other county. If you have that data somewhere, you really need to share it with us, your constituents, because it is not showing that on the IN.gov dashboard, which I'm sure you are all familiar with. I'm clearly here about concerns about our county mask mandate. As you know, the CDC has finally admitted that cloth masks really do not work. N95 masks are recommended by the CDC, but they do not fit children. They are not made for children. Even the CNN health expert this week has stated that masks should be removed from our children, that they are creating psychological and social harms beyond repair. The number of children hospitalized in the state of Indiana is fairly low. Now, any number is not okay, but our dashboard does not tell us if they are hospitalized for COVID or with COVID. Our Monroe County Board of Health, I know, gives you recommendations. And They have said that we need to keep the mask mandate until the cases are 50 per 100,000. I would like to understand where they're getting that number. It seems like an arbitrary number that they just pick something. If there is data and research, they need to share that with us. If you have data, please share that with us. If you have data showing that Monroe County mask mandate is working, please show us, because the counties to the right and left of us, some are lower, some are higher. The north, where there's no mask mandate, they're substantially lower. If you have data showing that this mask mandate has worked over the past 6 months, you need to show us. Otherwise, you are not doing benefit to our community. If masks actually worked, you would see statistical difference in the number of cases reported in Monroe County. To my knowledge, I have not seen that. If you have that data, I am asking that you please share that. Because of your decision as commissioners to continue the mask mandate, our schools have no choice, and us as parents have no choice for a health decision. Your job as elected officials is to make informed decisions to protect us as citizens and to protect our children. At this point, it does not appear that you are making decisions based on health. It really just seems as though you all are making decisions that are politically driven, and in this county, it seems to be political theater. Our kids are being harmed. You need to remove the mask mandate and put decisions in the parents.
Okay, thank you, Angela Northcutt. Two things. If Ms. Caudle wishes to respond, she can during her item on the agenda. And also, I will note that there is a Board of Health meeting at 4:30 on Thursday, tomorrow, February 10th. And that is a great place to pose those kinds of questions as well. And we do have another commenter here. It looks like Donovan Garlitz, who is a member of our election board. Can you confirm that that's you, Donovan?
Good morning. Can you guys hear me?
We sure can.
Wonderful. Thank you for allowing for public comment this morning. Donovan Garlitz, election board member, so obviously member of Monroe County, a resident of Monroe County. I'd like to first, Angela, thank you for your passionate speech on masks. While I certainly concur and would like to note that we are the only county that still has a mask mandate countywide imposed on us of 92 counties in the state of Indiana. That is as of last August, according to my research and multiple news outlets. The reason I actually came on was regarding my capacity as an election board member and my ability to meet in person. I was very, very excited last week when we started to get communication about the governor's health order expiring, and that we would have to go to the hybrid and or in-person meetings for countywide boards and commissions. And although I was incredibly confused and scratching my head as to why that expiration would be the impetus to going to in-person meetings, I was excited. And then the further we got along, and I'm not going to delve into all the communications on it, but it seems as if the commissioners that you three are using the governor's health order as a complete crutch as to why we can't meet in person. The order does not say anything about mandating that we cannot meet in person. None of the executive orders ever have. It simply says you cannot be any less restrictive than what they talk about. So like Angela, in noting about all of the other counties, not only our surrounding counties, but the rest of the 91 in the state, I did extensive research yesterday and did not find one county that has not been meeting in person since at the latest summer of 21. Now, do I agree that there should be a virtual option for those folks who are immunocompromised or wish to be virtual? Absolutely. I don't think I would want anybody to take that away. But I think it's important to have face-to-face contact, meet in person, and utilize the offices that everybody pays for, every Monroe County resident pays for. And I would just like to ask you to please consider getting us off this island that we are on, surrounded by 91 other counties in our state, none of which are doing what we're doing. Thank you. I appreciate time and the opportunity. You guys have a great day.
Thank you, Mr. Garlitz. Thank you for being here. And we will note that indeed, once we begin meeting in person, that there will be a virtual option that we will continue because we have created a well thought out policy to allow folks in the community who perhaps can't drive in for a meeting to be able to attend virtually. And that's for health reasons, but also convenience. We found that we've had a lot more folks attending our meetings because we have this Zoom option. So it's actually been a real benefit to public participation and transparency. All right, I don't see any other commenters. So we will move on to the next item, please, on the agenda.
Move approval of the minutes from February 5th, 2022.
Second.
We have a motion and a second. Any comments or edits on this?
Yes, I wanted to make sure that the amendment, the single sentence that was in the amendment gets added to the minutes. And that was that the properties described in Exhibit A value is less than that of preparing and selling the item. Therefore, it may be demolished, junked, or if hazardous, properly disposed of. I just want to make sure, since that wasn't in the original documents that were sent out, that that does get recorded somewhere.
Excellent. Thank you so much. Mr. Cockrell, will you please call the roll on approval of minutes February, it would be February 2nd, 2022.
Commissioner Thomas.
Yes.
Commissioner Githens.
Yes.
Commissioner Jones.
Yes.
Motion is approved, 3-0.
Thank you so much. Next item, please.
Move approval of claims docket, accounts payable February 9th, 2022, and payroll February 11th, 2022.
Second.
We have a motion and a second, and we have Mr. Miller here to tell us all about it. Good morning.
Good morning. The total for claims was $634,569.44. $100,665.75 was for Ubler and Sons, Inc. for 3 new 2022 Chevy Silverados for our highway department. $93,459.61 was for advanced correctional for on-site medical and mental health services, primarily for the month of March. $63,621.38 was for East Lawrence Water Authority, which was for utility relocation construction for Hunters Creek Road Phase 2. Finally, $42,375 was for American Structure Point, Inc. for right-of-way services, Fullerton Pike Phase 3 land acquisition, which sums up the larger expense items in our claims docket. As far as the payroll total is concerned, that was $1,174,801.43, $1,246,665.82 were for direct costs, and the remaining $528,135.61 were for the indirect costs of payroll.
Right. Thank you so much, Mr. Miller. Comments, questions, Commissioner Githens?
No.
Commissioner Jones?
No, I don't.
Any public comment on this item, please raise your hand on the Zoom screen, and we will take your public comment. Again, a 3-minute time limit per commenter. I do not see any hands raised. So with that, Mr. Cockrell, will you please call the roll on approval of claims docket, accounts payable February 9th, 2022, and payroll February 11th, 2022.
Commissioner Thomas.
Yes.
Commissioner Githens.
Yes.
Commissioner Jones.
Yes.
Motion is approved, 3-0.
Thank you.
Right, thank you so much. And with that, we will move on to new business, and we'll begin with item C, please.
Move to approve Indiana State Department of Health grant for COVID-19 vaccine administration fees. Fund name Health, fund number 1159, and an amount to be determined.
Second.
We have a motion and we have a second. Ms. Caudle, thank you.
Good morning. Thank you very much for moving this up. And I will just add a couple of things based on the public comment. And the first is, yes, the Board of Health meets monthly. They meet tomorrow night at 4:30 and public comment is taken. So I would encourage people who want their voice heard to please come and share that with the board. You can send an email and I'm happy to pass that on to all the board members as well. So please do that. There was a question about how the metric came for losing the mask requirement. And the current regulation is built around CDC's guidance that whenever there is high or substantially high transmission, that everyone indoors in public spaces should be masked. And that's where that is based on. So low to moderate transmission would be less than 50 cases per 100,000. So that's where that came from. And that would also put us in a blue advisory in the state. The board, again, does meet and certainly things change. You can look back every 3 or 6 months and things are never exactly the same. Things change. That's why the board meets, and we'll be talking about what's changed more recently tomorrow night, and then the board will make a decision. So that's kind of where we are. That's where it goes. The other thing that I would say in terms of data is that if you've paid attention to all those numbers and all the things on the state map as we go through, we have moved into, yes, the whole state is in bad shape, but we tend to be one of the better counties. And as I mentioned in the report, right now, where are we seeing the trends with numbers declining? They are in the northern part of the state, but that's also where the surge hit first, and they are coming out of that surge. And the southern part of the county saw the surge later. So those are all factors that just have to be taken into consideration. So to this request, last year we received, and I think it was at the end of the year pretty much, but we received a grant agreement from the state that technically isn't a grant. They are billing that vaccine administration fee on local health departments' behalf. But the mechanism for the state to disperse that money to us is through a grant agreement. And so they had to follow up with a letter and talk about all of that. So you signed last year's agreement. We thought it was fully executed. When we investigated why we still had not received money for reimbursement that other counties had, there was an issue with some signatures. There was an incorrect signature at the state level, and so we did not get money. So what is before you is for 2022, but it also goes back and covers 2021 so that they can release the reimbursement money that they collected on our behalf in 2021. So that's why this has a longer date on it. The previous agreement said it gave us a dollar amount of $25,000. This one did not, because it's just really based on what the reimbursement is, and there is no set amount. So we will go to council to appropriate funds as they come in and are received. And we are scheduled to go to council to get this money moved. Or again, originally it was set up, it came as a grant, it was special, we put it in a fund. Now we've been told it needs to be in the health fund. So we're going to council to move all that around and change that appropriation to the health fund. But we will be doing that finance side on that once you approve this grant agreement.
Excellent. Thank you so much. Comments, questions, Commissioner Giffens?
Yeah, I just appreciate the fact that our health department followed up on this and made sure that things were done correctly.
Commissioner Jones?
No, I don't. Thank you.
Yeah, I appreciate that you took a moment to address the question. And I think it's important to remember that, you know, counties are not boundaried by walls, they're porous, and people move back and forth. And so it's really difficult to assess a specific impact of one policy on one county when the neighboring counties aren't similarly set up. So I think that's something that's important to remember as well. It looks like we have a couple of members of the public who wish to comment, and this will need to be specifically on the grant agreement regarding vaccine administration, please. So first we have Angela Northcutt.
So can I respond to Penny's comments?
This isn't an appropriate time for that, but I think if you want to attend the Board of Health meeting, that would be a really great place to have a discussion with the board members.
So you mentioned it was $25,000. Is this the $25,000 that's used to pay Security Pro to enforce masks upon the citizens here? Or what is that $25,000 to pay the county to analyze data?
This is for vaccine administration only.
Okay, so I will get on the Board of Health, but overall, you are all still vote on it. It is ultimately your decision, not the Board of Health.
That's correct. Thank you. It looks like we have another commenter, and please limit your comment to this agenda item. Candace Sampson, if you could verify that that's your name and you're a Monroe County resident, please.
Hi, can you hear me? I'm actually in the car. Okay, yes, that is my name, and I am a resident of Monroe County. So just regarding the funding and the grant, are there any requirements to, I know it's probably not, and I didn't hear the first part of the meeting, but I apologize for that. Are there requirements for continuing mask mandates or anything, any other mandates tied to getting the funding from that last year or this year?
This is an agreement to related specifically to pay for vaccines.
Right. So there's no, are there any requirements other than having the location set up appropriately and, you know, all of that? Are there any other requirements for you to continue? I mean, are you planning on continuing these, you know, indefinitely or, you know, every year?
This is a great thing to talk to the Board of Health about, and we take our advice from those in the medical community whom we trust based on science and data. So
that's good to hear.
And specifically, there is no requirement like that in this agreement.
Thank you so much. And also, there's a lot of science and data that hasn't really been talked about in the public that's finally starting to come out. So I'm glad to hear that you are open to scientific discussion that is actually well-rounded and having many different voices.
Thank you. Okay. Mr. Cockrell, will you please call the roll on the Indiana State Department of Health grant for COVID-19 vaccine administration fees?
Commissioner Thomas?
Yes.
Commissioner Githens?
Yes.
Commissioner Jones?
Yes.
Motion is approved, 3-0.
Thank you so much. All right, next item, please, item A.
Move approval of ratification of emergency declaration and rescission of the emergency declaration.
Second.
We have a motion and we have a second. Mr. Cockrell.
Yes, as I'm sure everyone is aware, we had a winter storm last week. The president of the Board of Commissioners did declare an emergency as the situation warranted, and then did a rescission of that once she had information from the Highway Department and emergency management staff that should be rescinded. This is just to ratify those two decisions.
Excellent. Thank you so much. And a quick note of thanks to all of the great folks at our highway department, including the superintendent, Toby Turner. They did a wonderful job, and emergency management, especially Kate Petroline, did a fantastic job last week during the emergency. We were in communication the whole week about it, and they all did a phenomenal job, and can't thank them enough for keeping us safe. So with that, see if there are comments or questions. Commissioner Giffens?
Yeah, I just would like to say that as we were in touch with different people, we learned that like Kate Petroline was up 24 hours straight. Several of our highway road crews, again, out working up 24 hours straight. They didn't stop. And that's part of that dedication that makes a difference in our county.
Commissioner Jones?
Yeah, I agree with Commissioner Givens that we got remarkable service from our highway department and emergency management. This was the first emergency that Kate Petroline had to cope with, and I would say that it indicates that we can put a lot of faith in her to do her best for our community during any emergency. Thank you to all of you.
Yeah, it's a great point. Let's see if there is any public comment on this item. Raise your hand on the Zoom screen. Okay. Seeing none, Mr. Cockrell, will you please call the roll on ratification of the emergency declaration and the rescission of that declaration?
Commissioner Thomas?
Yes.
Commissioner Giffens?
Yes.
Commissioner Jones?
Yes.
Motion is approved, 3-0.
Great, thank you. Next item, please.
Move approval of Clark Excavating LLC agreement for demolition of surplus property. Fund name 2017 GO bond. Fund number 4715 in an amount of $9,900.
Second.
We have a motion and a second, and we have Mr. Crone here to tell us all about it. Good morning.
Good morning, everyone. Hope everyone's well today. This is a follow-up to a request that was presented in last week's Board of Commissioners meeting from Parks and Rec to declare 2 structures on mitigation property that the county has acquired from the state as surplus. This is the other half of that. This is for to agree for services with Clark Excavating to actually demolish those 2 structures and remove all the debris from the property. They will also bring to grade the surface and bring in any clean fill if they need to. That way it can be planted in grass and whatever else we do with the space. We did look at trying to recycle materials out of both buildings. One of the structures is a shelter half like you'd see it at our parks, but due to insect and water rot, there's no recoverable material from it. The garage structure at some point has been modified to be a residence that wasn't ever inspected or under permit. So due to things that were done inside of it, as well as water intrusion and animal damage, there was not any real material in there we're salvaging. So this is for the full demolition and haul away of both of those structures.
Right. Thank you so much. Appreciate the explanation. Comments, questions, Commissioner Giffens?
Yeah, I appreciated that thorough explanation. I was out with Kelly Whitmer, the head of our Parks Department, last summer to look at some of this, and I fully understand why both those structures need to be both demolished and moved. So,
yes.
Commissioner Jones?
I'm sorry?
Go ahead, Mr. Crone.
Oh, no, they're becoming a liability. It's a hangout for teenagers and things like that. So when we take that away, then that whole issue is no longer a problem for us.
Yeah, it's a good point. Commissioner Jones?
No, I don't. Thank you.
All right. Let's see if there's any public comment on this item. Raise your hand on the Zoom screen if you wish to comment on this item. Seeing none, Mr. Cockrell, will you please call the roll on Clark Excavating LLC agreement for demolition of surplus property?
Commissioner Thomas?
Yes.
Commissioner Giffens?
yes.
Dr. Jones?
Yes.
Motion is approved, 3-0.
Thank you, commissioners.
Thank you so much. Appreciate it. All right, now on to item D, please.
Move that we hear the 2021 Community Corrections Grant Annual Report.
Second.
All right, Ms. Strike, there you are. You are on, good. Good morning, and please share your report with us. I don't know if you need to share your screen.
I don't. Thank you for having me. In October of 1983, we formed our Monroe County Community Corrections, and it is part of our probation department. And ever since 1983, we've been receiving grant funding through the Indiana Department of Correction. And one of the requirements of managing the grant is to come before the commissioners in the community at the start of every year to provide just an overview of activities from the year prior. So that's why I'm here, to give you a little bit of an overview of what Community Corrections did and how we managed the grant for 2021. So in 2021, we received a total of $1,355,780 for grant funding. This funded our community corrections programs, our drug treatment court, and our mental health court, which are 2 of our 4 problem-solving courts here in the county. Our community corrections program consists of our day reporting program, our post-sentence home detention, our pretrial program, which also includes pretrial home detention. And we primarily, through post-sentence, serve clients who have felony convictions. But between pretrial and post, back in 2021, we served a total of 769 people with felony convictions or charges through some means through our community corrections program. Also in 2021, our pretrial services program completed 1,264 pretrial assessments. And just as a quick overview, since 2016, our pretrial program, Monroe County Community Corrections and Probation has been part of a pretrial program, pilot program throughout the state. We were one of the first 11 counties to have a pretrial program, in which we moved from defendants who were booked into jail being only able to get out if they posted some sort of form of money, to now a risk-based assessment tool to help our judges, provide the judges information to help them make decisions about release. I'm also proud to say that in 2021, the state of Indiana, the Indiana Office of Court Services, officially certified our pretrial program for 3 years, which means that our pretrial program follows national best practice standards. So we meet all the criteria to have a working and effective pretrial program. A few highlights about our problem-solving courts, overseen by our presiding judge, Judge Dekoff. The drug treatment court had its 493rd graduate by the end of 2021. And our mental health court had its 21st graduate by the end of 2021. And one of the last things I wanted to highlight is our department deals with a lot of data and statistics, which is of course vital because it drives our funding, it drives our policies. But the other day I was sitting in a meeting and hearing all these statistics, and sometimes it's easy to overlook that a lot of all of these numbers, all these data points have true human stories behind them. And our department, both Community Corrections and Probation, has dedicated ourselves to providing evidence-based practice services, which means that we are providing services to our clients that are based in research. We know that they are going to work, and we know that they are will affect the best outcome for our clients to not have to come back through the justice system. And we do that by building rapport with our clients, providing cognitive interventions with our clients during their appointments. And every probation officer, every support staff member of our department has a role in that to change lives. And in 2020, because of COVID, we had to change things up. We stayed open and we continued to see our clients, but we didn't have that same connection and that rapport that we had with clients that we normally do just because of distancing. But I'm happy to say that now in 2021 and beyond that we're back to full services, we saw a 40% increase in the use of evidence-based interventions during our client appointments. And I just wanted to share that because again, I know how vital statistics are, but every client that we work with has a unique story, a unique reason that they're in front of us, that we're working with them, and all our clients deserve to have our assistance in helping them make positive changes. And I didn't want to lose sight of that, giving credit to the hard work that the clients do, but as well as our probation officers and support staff in having truly dedicated themselves to providing best services to our clients. So thank you for letting me go on that soapbox, but I just wanted to highlight the work that our staff has done.
Great, thank you so much. Let's see if there are comments or questions. Commissioner Giffens?
Yes, I remember, I think it was 2 years ago when we all celebrated the 20th year of the existence of the drug court here in Monroe County. It was one of the was it the first in the state, or anyway, it was very early on when people were doing some of this. And listening to the graduates, they're people that stayed in the community, that stayed employed, that stayed with their families, that just kept people together. And they had formed sort of their own community in terms of helping one another even. One person said, oh, yeah, my car broke down and so-and-so helped me fix it. So in exchange, I cooked some food for him, kind of thing. It was just an incredible, incredible thing to hear how people felt uplifted by going through this.
Commissioner Jones?
Yes, I was wondering if when people have the pretrial assessment and are released, are they always released to home detention, or is there some discretion in that?
No, in fact, the last stat that I saw was that less than 1% of our entire pretrial population, so less than 1% of anybody that we've completed a pretrial assessment on ends up on pretrial home detention. So the judges have a wide range of services and options that they can release somebody to. The majority of defendants who are released to pretrial are released to non-reporting. So they never see a pretrial probation officer. They only receive phone calls reminding them to come to court, and it's a hands-off approach. And then we also have anything a little bit more to that is the next level of reporting is meeting with a pretrial officer, and they just meet once or twice a month and provide services or referrals, or as Commissioner Giddens said, help with housing, help with education, help with employment. So the more restrictive conditions for pretrial are the less used.
Thank you. That's very good to hear. Of course, people who find themselves involved in the justice system frequently find their whole lives turned upside down, and any efforts that are made to allow them to continue to be with their families and continue with employment are very important. This is really a wonderful program.
And I agree with my colleagues, and I think you made such a great point about data. We see data, we see numbers, but these are people's lives that have been changed for the better, and our community is better because of it. So really appreciate you bringing your annual report to us today. Thank you so much.
Thank you.
Okay. And now we have 3 agenda items. We're going to kind of take them all together since they are so similar.
I move approval of Sharp's Customer Care Maintenance Agreement for Prosecutor Child Support Division, Fund Name, County General, Fund Number 1000-0660, an amount that varies per month. Second, Pitney Bowes Postage Meter Agreement for Prosecutor Criminal Division, Fund Name, County General, Fund Number 1000-0009, an amount that varies per month. And finally, a contract for Pitney Bowes postage meter agreement for prosecutor child support division, fund name County General, fund number 1000-0660 in an amount that varies per month.
Second.
Okay, we have a motion and we have a second. Ms. Hamlin, tell us all about it.
Good morning, commissioners. These three items were brought to our attention by the auditor's office last week as falling under their new requirement, which is that any claim made on a maintenance agreement on a contracted service has to be signed by the commissioners. So we're just bringing these forward to have them signed by you guys so we can get our claims paid.
Right. Thank you so much. All right, comments, questions, Commissioner Giffens?
No.
Commissioner Jones?
Just thank you for taking care of this so promptly.
Yeah, we appreciate it. Excellent. All right, let's see if there's any public comment on this item. Okay, seeing none, we'll come back for a vote. Mr. Cockrell, will you please call the roll on the Sharp Customer Care Maintenance Agreement and the Pitney Bowes postage meter agreements as outlined?
Commissioner Thomas?
Yes.
Commissioner Giffens?
Yes.
Commissioner Jones?
Yes.
Motion is approved, 3-0.
Thank you so much.
Great, right. Thank you guys.
Thank you. Next item, please.
Move to approve the revised Indiana Railroad Agreement for Vernal Pike Trail Project, fund name West Side Economic Development Area, fund number 4920, in an amount of $20,000 and $5,000 per day for flagging.
Second.
We have a motion and a second, and we have Ms. Ridge here to tell us all about it. There she is.
Good morning. Sorry about that. And this is the railroad agreement. So you guys had approved an agreement, I believe 2 weeks ago, and there was a not to exceed amount for $5,000 in talking with the railroad. They were to put into that it was $5,000 per day. They also did say that is typical. That's what we had to pay for the Bridge 908. But they did state that they would work hopefully with us on the cost to get that lowered, but that would be the max. So it was revising that agreement.
Thank you so much. Comments, questions, Commissioner Giffens?
Yeah, I mean, we've been talking a lot about things related to economic development, and quality of place is one of the things that feeds into this. And certainly the trails that the county has been working on is part of that. So I appreciate all the effort that people have gone to make sure that this takes place.
Commissioner Jones?
Yeah, there are a lot of people who are looking forward to this trail being completed.
Yeah,
absolutely. Yeah, it's been in the works for a little while.
Yes, we're all eager. We're eager for spring so we can get out on the trail too. All right, let's see if there's any public comment on this item. Raise your hand on the Zoom screen. Seeing none, Mr. Cockrell, will you please call the roll on the revised Indiana Railroad Agreement for Vernal Pike Trail Project?
Commissioner Thomas?
Yes.
Commissioner Giffens?
Yes.
Commissioner Jones?
Yes.
Motion is approved, 3-0.
Thank you so much. And next item, please.
Move approval of Mdot change order number 4 for Cedar Ford Covered Bridge. Oh, wait a minute. Sorry, I skipped one. Let me go back. Move approval of Mdot change order number 3 for Hunters Creek Road Project Phase 2 and 3. Fund name Hunter Creek Road Phase 2 and 3. Fund number 8163 in an amount of $29,463.94.
Second.
We have a motion and a second. Please tell us all about it, Ms. Ridge.
So as stated in the change order, this is for additional cement that was required for the subgrade treatment based off of the testing by the stabilization contractor. The change order is a participating change order with Mdot, so that therefore it would be covered by 80%. The project status, it's 80% complete at this time, and we hope to be having this project completed in May. And I believe it started in 2014 was the first year it was federally funded. So
amazing.
Long it takes.
Right. Thank you so much. Comments, questions, Commissioner Giffens?
Wow, we're lucky that you've stayed in this job, I got to say.
It's nice to get some of them completed, I will tell you.
Commissioner Jones?
Yeah, it looks like there are several that are close to completion, which I'm sure will be kind of a sigh of relief for the department.
Absolutely. We would like to utilize local road and street funds for more community crossings, taking care of the roads that we have, doing more paving. So getting these big projects completed is going to help us in the long run to free up some of those funds.
Yeah, that's a great point. Thank you so much. Thanks for keeping this project on track through a lot of changes and issues. Let's see if there's any public comment on this item. You raise your hand on the Zoom screen. I don't see any hands for public comment. So Mr. Cockrell, will you please call the roll on Mdot change order number 3 for Hunters Creek Road project phases 2 and 3?
Commissioner Thomas?
Yes.
Commissioner Giffens?
Yes.
Commissioner Jones?
Yes.
Motion is approved, 3-0.
Thank you. And next item, please.
Yes, now we can go on to the Mdot change order number 4. Move approval of Mdot change order number 4 for Cedar Ford Covered Bridge, fund name, cumulative bridge, fund number 1135.
Second.
We have a motion and we have a second. Oh, Ms. Rich, tell us about this final change order.
This is a paper cleanup with Mdot. This is trying to close out this project that was completed. I think we opened it in 2019. So we're still trying to finalize the paperwork. So there was a 5-day delay in the notice to proceed to the contractor, which initiated a 5-day over the completion date, which it was not. The contractor would have been liable for liquidated damages, and that is not the case in this. So we're doing this change order to just clean that up to close out the project and get the dates to match up.
Yeah, excellent. Comments, questions, Commissioner Giffens?
Yeah, it's understandable why sometimes people get a little frustrated.
Commissioner Jones?
No, I don't. Thank you.
Yeah, this is another long-term project. It's nice to finally get this one done. Yes, excellent work. Thanks for the follow-through. Let's see if there's any public comment on this item. Just raise your hand on the Zoom screen. I don't see any commenters. So with that, Mr. Cockrell, will you please call the roll on Mdot change order number 4 for the Cedar Ford Covered Bridge?
Commissioner Thomas?
Yes.
Commissioner Giffens?
Yes.
Commissioner Jones?
Yes.
Motion is approved, 3-0.
Thank you.
Thank you so much. All right, we don't have any appointments today. We do have a few announcements, and we start with a message of condolences to the family and friends of Randy Paul. Our community lost Mr. Paul yesterday, and I would just note that his unflagging advocacy for disability rights has had an incredible impact on our community, and that he will indeed be greatly missed.
Yeah, I'd like to say too that Mr. Paul did things that a lot of people in the community don't know about. He was on the library board many years ago. He served as a vital tutor and things like that. And Randy never gave up. He is just an inspiration in terms of if you believe in something, you just keep working at it. And so I greatly admire him. And,
he definitely will be missed. And some other Announcements of note, we do have some board and commission openings. So if you're interested in serving on a board or commission, now is a great time to fill out that application to give your time, talent, and service to our great county. Just go to co.monroe.in.us and fill out the application. Also, the Township Assistance Fund money to assist folks who have been struggling as a result of COVID-19 financial impacts. This is to help with households to pay for basic necessities. This fund is being administered through the township trustees, and has reached $200,000 fund amount. If you do need assistance with basic necessities, please contact your township trustee as soon as possible. Every resident of the county lives in a township, and you can find your trustees by calling 211 or going to in211.org for more information. Do my colleagues have anything else to add to the announcements today?
Yes, there are two more blood drives set up for the end of March, and I forgot to pull off the dates, but I apologize for that. But if people go to redcross.org, they can find those. And like I said, they're at the end of March, back-to-back days, I believe, one later in the day, one in the afternoon. And I have to say, last week when I was out donating, I was amazed that the people had come down. The workers were from Indianapolis, and they stuck around to make sure that things got taken care of. So many people came, they contacted them, they came in early for their appointments. Basically, it was another very, very successful blood drive.
Yes, and Ms. Petroline always lists the blood drives on the county website. Just go to co.monroe.in.us and go to the emergency management page, and you will see the list. But yes, you do need to make an appointment through redcross.org. Excellent. All right. We do have some items for our work session. Can we come back at 11:10 for our work session? Does that work? Excellent. And so with that, we are adjourned. Thanks, everyone.